This is your review for DH105 Chapter 3. I'm going to go through some of the anatomy of the skull that you'll need to know for your quiz on Tuesday. I'm going to start here with the frontal bone. This blue area right here is the frontal bone. We're going to move over. These are the parietal bones, these two green bones. They are separated by the sagittal suture. The frontal bone and the parietal bones are separated by the coronal suture. You can kind of remember that, think of sort of like a crown. And then we've got the occipital bone, which is separated from the parietal bones by this serrated looking lambdoidal suture. Then we've got the temporal bone, this big orange bone. It is separated from the parietal bone by the squamosal suture, which comes right around here and separates that bone. And then we've got the zygomatic bone, which together with the temporal bone forms the zygomatic arch or the cheekbone. That's this purple bone is the zygomatic bone. And we've got the maxilla, which is this yellow one right here. So I'm going to go through some features on these bones. So let's start with the frontal bone. We have what we call the supraorbital ridge, or supra being above the orbit. And that's this kind of sharp ridge right here. And about halfway across the orbit is a little indentation called the supraorbital notch or supraorbital foramen. And then we've got the occipital bone, which is this big brown bone right back here. And on the occipital bone, most of the anatomy is on the inside, so I will show you that when we get to the inside of the skull. But you will need to know the foramen magnum, which is this big, large opening where the spinal cord passes through. And then you've got your occipital condyles, and we'll review this again when we get to this inferior view of the skull. But the occipital condyles are right here, these two flat surfaces next to the foramen magnum. And they are the way that the skull sits on top of the vertebrae and rotates with the vertebrae. And then you've got the hypoglossal canal. And the hypoglossal canal is hard to see on this skull, but I will show you the hypoglossal canal when we look at the other skull. We've got the parietal bones. The parietal bones are these green bones right here on the top. They are separated by the sagittal suture. They are usually covered with hair. They're these big bones right here. There's really no anatomy on them. And then we've got the temporal bone. This is the temporal bone right here, this orange one. And it's the one that meets to form the zygomatic arch. There are several things we're going to need to know on the temporal bone. So I'm going to show you different views. We're going to start with the inferior view of the skull. And some of the features you will need to know on the inferior view of the skull is, let's start up here with the maxilla. This yellow bone right here is the maxilla. And on the maxilla, it's divided down the middle with the median palatine suture. And the median palatine suture is the suture that combines the bones that form the hard palate. There are 4 bones that form the hard palate. The first 2 are the palatine processes of the maxilla, and these other 2 purplish colored ones are the horizontal plates of the palatine bone. They are divided vertically by the median palatine suture. They are divided horizontally by the transverse palatine suture, and together they form kind of like a T shape like this. All 4 of those bones make up the hard palate. It can often be confusing to students that they think the yellow ones are the hard palate and the purple are the soft palate. All 4 of those bones together make up the hard palate. And then right behind the hard palate, we have this green bone. This is a facial bone called the vomer, and it goes up into the nasal area. And you can see, if you look inside the nose here, this white bone is the perpendicular plate of the ethmoid bone. It sits perpendicular to the bone. And so this is the perpendicular plate of the ethmoid bone, and it meets the vomer, and together those two bones make the nasal septum. So you've got your perpendicular plate of the ethmoid bone, you've got your vomer, together they make your nasal septum, which is right kind of down the middle of the skull. This white bone right inside here is the ethmoid bone. It's a rather small bone. You can kind of see it from this view in here. It's the ethmoid bone. And the pinkish red color one right here is the sphenoid bone. And we're going to go over the sphenoid bone here in a few minutes. So let's go back to your temporal bone. Right here on your temporal bone, you have your external acoustic meatus, or basically where your ear is. And that's where the outer part of your ear is on your skull. And then you've got your temporal process of the zygomatic bone and the zygomatic process of the temporal bone. And I've told you before, of the bone means on the bone. So your zygomatic process of the temporal bone means it's on the temporal bone and it meets the zygomatic bone. So this would be your zygomatic process of the temporal bone. This would be your temporal process of the zygomatic bone. They meet together to form the zygomatic arch, or your cheekbone. And then we've got, if we flip this over to the inferior view of the skull, we've got right here something called the styloid process. And I'm going to flip to the other skull so you can see it a little bit better. This right here, this little spiny thing right here, is called the styloid process. And then right back here is the mastoid process. And in between the styloid process, this sharp spiny thing, and this more blunt area right here called the mastoid process is a little tiny hole, and it's right there. And it's called the stylomastoid foramen. So you've got your styloid process, you've got your mastoid process, and then you've got the stylomastoid foramen. And that's where the seventh cranial or facial nerve it exits through the skull. And then you've got your foramen lacerum, which is this one right here, this hole. So we're going to go through, you've got your foramen lacerum right here, your foramen ovale, and your foramen spinosum is this little tiny one right here. Below that, right here, this one that doesn't go anywhere is your carotid canal. And then below that, right here, I don't know how well you can see that, but there's an opening right here. That's your jugular foramen. So that's where your jugular vein passes through. So those are the main things you need to know on the skull from the inferior view. On the sphenoid bone, let's look at the sphenoid bone. Let's see, give me the other skull here. The sphenoid bone is this reddish pink colored bone here. Let's see, on the sphenoid bone, we're going to look at, well, we're going to have to look at it from another view. Let's take it from this view instead. So now we're going to look at the superior view of the skull. So what we're doing is we're looking, here's your skull, we're looking down into it. Before we were looking up, underneath, now we're going to be looking down into it. When we look down into it, this is the one I gave you the video for the foramen. But we're going to start up here with the optic canal. Right up here is your optic canal. And if you stick this little thing through it, you can see it comes through in the orbit. That's the optic canal. Next to the see it right there. Next to the optic canal, you have your superior orbital fissure, which is right here. There's your optic canal right there. And there's your superior orbital fissure. And then you've got your inferior orbital fissure, which lays right here. So we've got superior and inferior. And they make almost like an arrow shape pointing toward the nose, if you look at it from that way. And you can kind of see that, see how they make like an arrow, almost kind of pointing toward the nose, right here. and those are your fissures. Let's see, what else do we have? We're going to go through, so we've got your optic canal and your superior orbital fissure, and then you've got your pterygoid canals. So let's see, those are actually on the other view. We'll get back to those. We've got your foramen ovale. So we've got up here a foramen rotundum, which is this one right up in here. And then you've got your foramen ovale, so this big oval one. Right below it, the foramen spinosum, and your foramen lassurum. And so if you start up here, you've got rotundum, ovale, lassurum, spinosum. So R, rotundum, O, ovale, L, lassurum, and S, spinosum. ROLS, rolls. And that's what the video, the YouTube video I showed you goes through. That's probably the best way to remember that. And then below that, over here, we've got your internal acoustic meatus. So we had the external that was on the temporal bone, and here we've got the internal, so where the eardrum comes into, or the sound comes into the skull. And then we've got the jugular foramen down here. And of course the foramen magnum being the big hole where the spinal cord passes through. And then right here, we've got your hypoglossal canals. So if you were looking at the inferior view, and then you flip it over and you look at it from the superior view, that's the hypoglossal canal. So going back to our foramen, so we've got the foramen rotundum. The foramen rotundum is kind of hiding underneath this area right here. So we've got optic canal and foramen, and then we've got your foramen rotundum. If you try to stick this thing through, it does not come through to any other side, so you can only see it from this view. You cannot see it from the inferior view on the foramen rotundum. However, the foramen ovale, we saw it from the inferior view, and here it is from the superior view. It's the big oval one. Foramen spinosum is too tiny for me to stick this thing through, but it sits right lateral, just lateral to the foramen ovale. And then the foramen lassurum, here it is from the superior view, here it is from the inferior view. And then the jugular foramen is right, this big one right here, the jugular foramen, and here it is from the inferior view. It sits right next to this area right here, the carotid canal, but the carotid canal we cannot access on this view. We can only see it on the inferior view because it doesn't go all the way through for us here. So those are the main parts of the skull that you need to know. As far as the facial bones, we've got on the facial bones, I talked about the vomer already. And if you remember, the perpendicular plate of the ethmoid bone meets the vomer, and together they form the nasal septum. And then you've got your lacrimal bones are these two little red bones right here, the lacrimal bones. On the nasal bones, we've got these two purple ones right here. They form the bridge of the nose. The nasion is right here at the top where the frontal bone and the nasal bones meet. Right here where the nasal bones and the frontal bone meet. That's your nasion right there, that area right there. And then your piriform aperture is this whole opening or hole for your nose. And that's the area that's cartilage. And then you've got your nasal concha. Your nasal concha are these little shelves right in here. You cannot see the superior. This one right here is the middle, and this bottom one down here is the inferior. The inferior is its own separate bone. It's a facial bone. The inferior nasal concha is a facial bone. The superior and middle are not separate facial bones. They are part of the ethmoid bone. They come off of the ethmoid bone. Then we've got the zygomatic bone, and we talked about the zygomatic arch. And the palatine bone, we've already talked about again. Two bones right here. We've got your incisive foramen, which is right up in here, and you can see that much better on this skull. Right here, this little opening is your incisive foramen. That's where your nasopalatine nerve enters through the skull. And then back here, you've got your horizontal plates of your palatine bone with your greater palatine foramen, which carries your greater palatine nerve and arteries. And then there's a tiny little one just below it called your lesser palatine foramen. And it's right there. And that's for the lesser palatine nerve and arteries. On your maxilla, the areas to know on your maxilla, the area that covers the roots of the teeth is called your alveolar process. So we've got an alveolar process of the maxilla. We also have an alveolar process of the mandible, but we'll talk about that when we get there. You've got your canine eminence, which is this area right above the canine where the root sticks out, and just distal or just behind it, posterior to it, this indentation is your canine fossa. And then let's see, we've got your infraorbital foramen is right below your orbit. It's this little foramen right on the front of the skull, right here. You can see it right there. And then we've also got your maxillary tuberosity, which is this bony area right just distal to the most posterior molar in the mouth. And then we've got your mandible. So what do we need to know about the mandible? We've got the ramus, which is this flat area right here. And then we've got the alveolar process of the mandible, which are these the areas that house the roots of the teeth. Sorry. Then we've got your mental foramen. Your mental foramen is this little hole that's right just to the roots or apices of the premolars on the mandible. We've got your mental symphysis. Your mental symphysis is this little area. It's kind of where the two bones fused. It's elevated slightly. It marks the fusion of where the mandible fused together. And your mental protuberance is your chin. And then you've got the body of the mandible, which is this horizontal area that sits below the roots of your teeth. So down here is the body. So we've got the ramus, the body, and together they're joined by the angle of the mandible. Right there. Then you've got your external oblique line. So your external oblique line is this line right here that runs off of this kind of sharp ledge. This somewhat sharp ledge is the coronoid process. And right about halfway down, you have your coronoid notch, which is a little indentation here. That's your landmark for your inferior alveolar nerve. Below that is your external oblique line or external oblique ridge right here. See how that comes down right there? This right here is your retromolar triangle. It's on the most distal of your lower molars. Then we've got your mandibular notch, which is right here, this area that dips down. Your mandibular condyle, is right here. It's this whole thing right here is your mandibular condyle. This is the neck of the condyle. This is the head of the condyle. And this is the articulating surface. So this is the part of the condyle that articulates or moves with your TMJ. So it sits like this, and this is how it moves. And that's your TMJ, temporomandibular joint. It's where your temporal bone meets your mandible. And that's the articulating surface is what it moves on. Then we've got, if we turn it this way, you've got your genial tubercles, which are these little bumps right here. And they are, they can be seen on a radiograph as little radiopaque areas. They are for muscle attachments, and we'll talk about that next chapter. You've got your mandibular foramen, which is this little hole right here. And that's where your inferior alveolar nerve transfers through. The mandibular canal is right here. So the foramen's the opening, the canal holds the nerve. And then right above it, you've got this little piece of bone that sticks out, this spiky little piece called your lingula. And it kind of hangs over a little bit over the foramen right here. You can kind of see that ledge. And that's called your lingula. And I believe that's probably about all that you really need review on. But if you have any questions, please also look at your other videos that I had recommended. And if you have any questions, feel free to email me. But try going through this review and all of your other resources and make sure that you can label all those parts. Good luck. Thanks.